and welcome to DD Science. As we talk today on a special program, India fights Corona. The Google charts have gone viral in looking up what is coronavirus, and people all over the net are sending misinformation on WhatsApp groups. To talk about the speed and the scale of containing this virus done by the GOI, we have with us today the man of the moment, Dr Randeep Guleria, Director, All India Institute of Medical Sciences and one of the brightest minds of India. It is indeed our privilege and pleasure to talk to him today. So as we speak, the epidemic has spread to over 170 countries, and there have been more than 10 deaths in India today and more than 500 infected. How do you see stage 2?
So I think that currently in India we are maybe in a little better position as compared to some countries in the West, but the number of cases have started increasing, and we are gradually moving into a stage where we will start seeing a peak in the number of cases, and we may start having community spread. That is the reason why, after a lot of deliberation, the government of India has done or has moved into this drastic step of having a complete lockdown and curfew, because the challenge is to prevent this spread and clusters from happening early rather than late. If the disease already spreads and then you start having a lockdown, then you are doing it once the sort of horse is outside, has left the stable. So I think that is why we need to do it early, and there are signals which suggest that some degree of community spread may be about to start, and we have to prevent that in a big way.
So as we talked today, WHO has applauded India's efforts, and indeed the lockdown is of immense help and could be even extended if it doesn't work in the period that we have been told. But on a major question, there is a little difference on people's minds as to how this virus started, whether it was by a bat or a reptile. If you could give us a little more information about that. And the Wuhan epidemic rolled out on 31st of December, and now the epidemic in Italy and Madrid and all these places is indeed worrisome, and people are indeed very, very scared of the epidemic. What do you feel is going to happen next, and how did this virus actually roll out?
So this virus originated from Wuhan. It is definitely a novel virus, that's why it's called novel SARS virus. The issue to remember here is that this is a virus, as far as humanity is concerned, there has been no exposure, and that is predominantly because it has jumped species. It was a virus which was there in bats. It mutated or changed and became a human virus. Then it also developed an ability which is very important for a pandemic, and that is sustained human to human spread. There are certain viruses which jump species. They go from animals or birds to humans. Or we had bird flu, which was H5N1, which was an influenza related virus, but that virus caused illnesses only in those people who were working in poultry, because if you came in close contact with poultry, you got it, but they were not able to transmit the infection to other humans.
Right.
So human to human spread was not happening. This new or novel coronavirus developed the ability to spread from one human to the other rapidly, and that's how you started having huge number of cases in Wuhan. Now it was limited to Wuhan for a long period of time because of the number of cases and number of people traveling from China to different parts of the world. The virus gradually was able to let's say slip the net and reach different parts of the world, and wherever it reached are actually linked to places where there are huge flights coming in from China itself, that is Europe and parts of USA and also Korea and Japan. Based on how the people traveled with the virus, if you have infection, let's say I get the infection with coronavirus, it may take me up to 7 to 10 days or 14 days to develop symptoms. That's the incubation period. During that time I will have no fever, I will have no symptoms. I can pass through any thermal scanner and they will not pick me up. Unless I report to the health authorities when I reach there that I have these symptoms and I have traveled, it will not be picked up by anyone, and you will spread the infection in your own community. And in the beginning, as happened in Italy or in other parts of the world, there were a few number of cases, people did not give it that much of importance, and then there was a huge spike in the number of cases, and then lockdown was done. We have preempted that and tried to do an early lockdown so that we prevent the spike in the number of cases and sort of bend the curve,
contain it
and flatten it a little bit, so that we may have cases which may continue for a longer period of time, but they are manageable. They don't become huge as is happening in Italy, that you have no ventilators, you have no beds, and you're converting stadiums into hospitals. Right. That type of situation is happening at a global level.
And are we looking at re-looking at manpower ourselves, because as we speak, COVID hospitals in states have also been directed by the GOI. But sir, we need more forces to come in, maybe interns, PGs. How do you look at all this?
So there is a plan in place where interns will get posted to COVID wards. Doctors working in other areas, they could be surgeons, they could be paraclinical people, they could be working in say eye, ENT, will get posted. We are already working on training them in terms of infection control, in terms of basic principles of management, and therefore the pool will be increased by healthcare workers being drawn in from other areas which are otherwise not looking after medical cases but are more surgical, because surgery has been stopped or emergency surgeries have come down. So we will be able to develop a larger pool of doctors who can therefore manage these patients.
What are the asymptomatic symptoms? Because people are a little confused, because this is same kind of flu or fever. Some people are even hallucinating, imagining the flu, and dahshat phaili hui hai, to be very honest. And they're also going to various parks as we speak, and taking their pets. So some kind of a lockdown there as well.
So when we're talking about lockdown, it's a total lockdown. If you feel that you can go to the park and you meet your friends there and sit and
Party,
chat there, then that is not a lockdown. Lockdown is that you don't come in contact with any other individual and you maintain social distancing, because it's a spread from one human to the other. So if you are able to have a very aggressive lockdown, that there is no physical communication or physical contact between two individuals, you will be able to prevent the chain of spread that is happening. Second important thing is that it's important to understand that this is a virus which is also gets settled on surfaces, and these surfaces could be tables, it could be chairs, or if you have a cold and cough and you have that infection and you're rubbing your nose, the virus can come onto your hand, and if you touch any surface, say a doorknob, and you open the door or you touch the handle of a door, the virus will get onto that doorknob and stay there for some time. And if another individual sometime later touches that doorknob, the virus comes onto his hands, and if he touches his nose or his mouth, the virus will then transfer itself immediately to that person's respiratory tract. Therefore, along with social distancing, hand washing and proper hand washing is also very important, because this is also a droplet infection which stays on surfaces for a few hours. So you must wash your hands regularly. That will also help in breaking the chain of command.
And better hygiene for India. But when you just said that, the parcels and the e-commerce companies that are sending in, say from Amazon, people are ordering food, how careful should they be, to sanitize that as well? As we speak, we've sanitized the mics also.
So sometimes we're going a little bit overboard, but I think that's good. But my own issue is that as far as cardboards are concerned, the virus doesn't stay on that for a very long time. And even if you touch anything from outside, wash your hands properly and make sure that you dispose of these things properly. Chances of it staying on surfaces which come through courier or through other means is very low. I believe people have stopped picking up newspapers because of the fear that the newspaper may have it. There is nothing like that.
And on that note, we are going in for a short break. Stay tuned. We'll be back with more on India Fights Corona.
The Bhaskar Advanced Solar Energy Fellowship Program, a joint initiative of the Department of Science and Technology, Government of India, and the Indo-US Science and Technology Forum, aims to nurture future innovators and scientists in the field of solar energy. The fellowship will also foster contacts between students and scientists from India and the United States. The selected Indian students will get an exposure and access to world-class research facilities in US institutions. After the successful completion of the BASc Fellowship program, the students can have exciting career options from working in regional technological institutions and IITs to high-tech CSIR laboratories. The Bhaskar Advanced Solar Energy Fellowship Program is an initiative by the government of both India and America to provide world-class exposure to the upcoming scientific minds and nurture their talent in accelerating the solar revolution in India.
India Science is an internet-based science TV channel initiated by the Department of Science and Technology, Government of India, implemented and managed by Vigyan Prasar. India Science on the URL www.indiascience.in is a bilingual channel with content in Hindi and English. It can be accessed on any internet-enabled device. This video platform is dedicated to science and technology knowledge dissemination with a strong commitment to spreading scientific awareness, especially with Indian perspectives, ethos and cultural context. The India Science mobile app can be downloaded from the Google Play Store and Apple Store.
When you do not like limits, when you are a seeker, a dreamer, and always questioning what if, why not, and how, when you want to know every bit of it, when you want to explore every inch of it. DD Science from 5 p.m. to 6 p.m. every Monday to Saturday.
हाइड्रोक्विनिन के बारे में आप क्या कहना चाहेंगे? बिकॉज जैसे डॉक्टर भार्गव ने ICMR में कहा है कि दिस इज अ ट्रीटमेंट फॉर मेनी पीपल, इट कुड बी यूज्ड, सो हाउ इफेक्टिव इज दैट?
So, we have two drugs, chloroquine and hydroxychloroquine. Both have been used in India for a very long time. And hydroxychloroquine is a safe drug. Most of us as clinicians and even rheumatologists, immunologists and even dermatologists have used this for maybe more than 20 years. And we know that it is a safe drug. The data on its efficacy in COVID-19 is limited. There is very little data. There is some data which has come from the previous coronavirus, MERS coronavirus. Which
The one that came from camels.
Which came from camels and which is in the Middle East. So, MERS is Middle East respiratory coronavirus.
Right.
That and some experimental data on cultures, viral cultures, on animal studies and little bit of human data which suggests that hydroxychloroquine may be useful in treating or decreasing the viral load as far as COVID-19 is concerned. However, we don't have time to wait for a large number of good studies to come before we start using it. And that is why it was felt that we should, if a drug is safe, take that risk and see whether we can protect healthcare workers and those who come in close contact with COVID-19 patients, because even if we are able to protect them to some extent, then we can prevent the infection from spreading both to healthcare workers who have to stay healthy to be able to provide care and the people who are actually coming in close contact because they are at the highest risk of getting the infection and transmitting it further. At the same time, data is being collected from these individuals to see is it effective, is it safe, and if one finds that this is an effective and safe strategy, then it can be used for larger group like high risk groups to treat them, the elderly, to see whether it can be used in them and it may protect them. This is a treatment which is also, this is a drug which is also useful for treatment. So, that is the next step. Can we use this drug as a treatment strategy for, let us say, moderate to severe cases admitted with pneumonia, and will it benefit or not? The answer is still not there. Some studies suggest it may, other studies say that this is still experimental, more trials are needed. So, my take on this is we should try and do the trials simultaneously because we are in a pandemic. We are having a situation where large number of people are getting infected, number of people are dying. We can't wait right now for a lot of scientific studies to be done. We have to treat
wait for
and
the research to happen later on.
do research simultaneously.
There is another group which says there is a variant of AIDS HIV drug that was used in Jaipur for 2 people and managed to make one all right, and the other one succumbed due to a cardiac arrest as we talk. But then there is this same variant that was used perhaps in Wuhan.
So there is a drug, lopinavir and ritonavir, which are basically available in our country, used for HIV positive patients. These are anti-HIV drugs. Initially there were studies which suggested that they were useful, and that's why a lot of people thought that this could also be used. A study was done for Covid-19 in Wuhan, in patients in Wuhan. That was a good study, a randomized trial which was published a few days ago. It did not show any benefit. It was a negative study. So that is why that drug has come lower down in the list right now, because a proper study showed that it was not of much benefit as a cure as far as that is concerned. There is another drug which was used for a patient in US who improved, remdesivir, which was also used for Ebola cases, which is also an antiviral drug, and there are some data which suggests that it may also be useful. Again, it is being tried in the US, and there is studies going on in Europe also for this drug. It's an injectable drug. So there are a lot of research going on right now at a very fast pace to find solutions which are proven and which are effective. Those solutions which are easy to do and which are safe are what we think we should try early. For the others, we need more data.
What about immunity boosters? If you look at India, we are those people जो नलके का पानी पीते थे, and as soon as we went to bottled water, our immunity system was much more stronger. So how do we kind of build immunity and take some positives from this?
So because of the fact that from very early childhood, individuals in India get exposed to a number of infections, their immune system is always active to fight infection rather than develop what we call autoimmune disease. This is also what is known as a hygiene hypothesis, that those who live in a very hygienic environment, their immune system to fight infection is not as strong, and they get a lot of autoimmune disease.
The toxic ones fight it better.
But from the point of view of COVID-19, I think we don't have much data to say that we are more protected as compared to the Western people. I think we are equally at risk, and we need to be careful. A good healthy diet, regular exercise is what is important, but I don't think I could say that you have a specific immunological drug which can protect you against COVID-19.
Well, what about the COVID tracker? Some use of technology to track people. Are we on it as far as AIIMS is a research hospital?
So there is a lot of interest in looking at how can we track patients who are positive, how can we do it on a GPS model, how can we map not only those, how can we map all those cases who are being tested and positive to really look at it at a national level.
Because some of them are not opening up and saying I have this, and they've been screened at the airport, and there has been some negligence. We have to admit our faults.
So that's the thing. So can we use technology, and India is very good in this, to be able to track, to monitor, and to be able to use that technology to be able to contain any outbreak or any cluster from developing. And if you pick that up, can you sort of totally quarantine that area so that it doesn't go out was done in China or in Wuhan for that matter.
Or Madrid for that matter. But sir, there is also a specific query from a lot of people about beds in hospitals, saying that you have a ventilator which can, by using AI, or an algorithm, look at 4 patients, and we could perhaps use that.
So that is something which has been done in Italy. It's not the ideal situation. In Italy, what was done was that they ran out of ventilators, and they had more patients and less ventilators. So they developed a system of looking at the patients and seeing if they had similar type of body weight and the lung, and they used one ventilator for 2 or 3 patients by using a tubing which gave Y connection. So one ventilator was ventilating 2 individuals at the same time. That is not an ideal situation. It's been done as an emergency because nothing else is available. But yes, that strategy was used in Italy, and that strategy is something that has been tried. There is not again much data. This is again things which are being done out of desperation, And therefore, my plea to everyone is that let's be very aggressive in social distancing, hand washing, and trying to contain and blunt the peak, because if we have a huge number of cases, we will have a huge problem, as is happening in Italy or in the US.
And on that note, we are going in for a short break. Stay tuned.
Ministry of Science and Technology, propelling India's developments. Vigyan Se Vikas. Scientific advancement is now a priority. Low-cost innovations have made healthcare accessible to lakhs of people, boosting the Swachh Bharat mission. Rural S&T interventions for sustainable development. Light transport aircraft Saras developed. Indigenous mathematical models and high computing for weather prediction at the taluka level. Biotechnology leveraged for developing climate and pest resilient plant varieties. Fellowships attracting young talents to science. India participating in international scientific efforts. Reaching the unreached. Boosting science for better life.
When you do not like limits, when you are a seeker, a dreamer, and always questioning what if, why not, and how, when you want to know every bit of it, when you want to explore every inch of it. DD Science from 5 p.m. to 6 p.m. every Monday to Saturday.
Sir, is COVID-19 of any concern to animal husbandry?
Currently, there's no data, and a lot of people worry that what about pets, and can they get the infection or can they give the infection?
I think nature has reclaimed the spaces. They're having a party instead. You know, all the birds, you can see them suddenly, and the dogs and all that.
So, although this virus started from animals and jumped species, it is now a human virus. So, it is no longer has anything to do with animals. So, as far as pets are concerned or animals are concerned, neither can they get the infection, nor can they give the infection to humans.
What about summer or humidity? Will it kill the virus?
So, there is a feeling that in summer, because the temperature goes up, the survival of the virus in the outdoor environment may become less, especially when it's very hot. But let me give you a rider here. Singapore had a significant number of cases. It's a tropical country. We are seeing a large number of cases in Kerala. Kerala has already got temperatures which are in the 30s. And you should also remember that most of us also stay in summer indoors. And indoor is air conditioned. The temperature and humidity there is controlled. So, even if you are inside and you are coughing and you are having the infection, you can spread the infection in the indoor environment, which could be a shopping mall, it could be your office, and therefore, temperature is not the solution as a whole to say that the virus will die because
What
of
about testing labs and kits, and 4,500 for a person, you know, who's from a poor background or low economic strata? How do we look at that?
So, my appeal would be that this is the upper limit. I would say that all labs should look at costing and see whether they can bring the cost down on their own to bare minimum and even free if the patient cannot afford. And as we are looking at the next few days, we are going to get new and new kits available, which will actually make the cost even lesser. And I am sure that over a period of time, we will have kits available and treatments which will be much more cheaper. So, I think all labs should look at the costing and try and do it at just the cost rate. Don't look at a profit.
People are saying it may worsen before it ends. What is your take over here? How do we actually look at preventing stage 3 in India? Do's and don'ts, sir.
So, from my point of view, if you want to prevent stage 3, social distancing, hand washing, staying at home, listening to what the government says, and rigorously enforcing the lockdown are the solutions for it. It's time for us to do this aggressively, otherwise we will regret later on, and then we will not be able to change the course of history. So, this is the time that we have to really work aggressively and work as a team, work as one nation. Every citizen of the country should understand his responsibility and be able to do that. If we do that, we will be able to prevent our country from going into the next stage.
What Dr. Guleria has just said is that it's going to take more than a namaste to shoo away corona and ban this virus from our country. So the entire India should come together and fight this virus. And on that note, many thanks for joining us, sir, and sparing your precious time. It was wonderful talking to you. And let's just hope India beats corona.